How do the principles that guide orthopedic surgeons today stretch back thousands of years? And, well, why are they more critical than ever in our rapidly advancing medical landscape?
It's a really profound question.
It is, isn't it?
Mm.
Because ethical considerations in orthopedic surgery, they're far more than just a set of rules. They are truly the very foundation of trust between a patient and their surgeon.
Absolutely. And once that trust is fractured, it's incredibly difficult to mend.
Welcome to the Deep Dive, the show that acts as your shortcut to being genuinely well-informed. We take complex subjects, dig deep into the core concepts, and pull out those surprising insights and practical takeaways that, well, really help you understand what's paramount.
Mm.
Today, we're plunging into the intricate world of ethics in orthopedic practice. We'll be exploring the core principles that guide these vital medical professionals, the evolving challenges they face,
Yep.
and the profound responsibilities orthopedic surgeons bear, not only to their patients, but, to the wider community, too.
Yep.
And to guide us through this fascinating and often nuanced discussion, we have with us today Prof. Mo Imam, a truly insightful mind, adept at distilling complex information, connecting disparate ideas, and offering deep analysis on why these ethical considerations are so vital in the real world of orthopedic surgery. Welcome.
Thank you. It's a real pleasure to be here to unpack such a crucial topic. The stakes in orthopedics are incredibly high. They affect a patient's mobility, their quality of life, and often their very livelihood. Ethics is truly the bedrock upon which all successful treatment must stand. It really is.
Absolutely. We often think of medical ethics as, well, perhaps a relatively modern concept, maybe emerging with major scientific breakthroughs. But the truth is, its roots are ancient, aren't they?
They are indeed.
Could you eliminate how far back these concerns for patient welfare and proper physician behavior truly go?
Yes, what's truly fascinating here is that the bedrock of medical morality stretches back millennia. It really does. We're talking about origins as far back as, say, 2000 BC
Yeah.
with the Code of Hammurabi. This ancient Babylonian code already laid down incredibly specific guidelines for patient welfare and the appropriate conduct of physicians. It even stipulated punishments for malpractice.
Really? Back then?
Oh, yes. It's a testament, really, to the enduring nature of these concerns. It shows that the need for trust and accountability in medicine isn't a new phenomenon at all. It's more like a foundational human requirement. Later, of course, came the Hippocratic Oath, with its timeless principle exhorted by Hippocrates to abstain from doing harm, often famously rephrased as, first, do no harm.
The classic phrase.
Exactly. And this wasn't just a suggestion. It was a profound declaration of intent. It framed the medical professional's role as one of profound responsibility to the vulnerable.
So, this idea of doing no harm is ancient, but the relationship dynamic itself has shifted dramatically, hasn't it? From a sort of paternalistic approach where the doctor knew best
Yes.
to something far more patient-centered. What was a pivotal moment in that evolution?
That's a crucial point. The shift from a paternalistic doctor-patient relationship, where the physician largely made decisions for the patient, to one that embraces greater patient autonomy, well, that's a monumental evolution.
Right.
A critical turning point was undoubtedly the Nuremberg Code of 1947.
Ah, yes.
Born from the horrific context of non-consensual and unethical Nazi research, this code fundamentally underlined a patient's right to understand, to choose, and most importantly, not to be harmed.
It really cemented that idea.
It really did. It cemented the concept of informed consent as a cornerstone, moving the patient from being a passive recipient of care to an active partner in their own health decisions.
A partner.
Yes, this wasn't merely a legal decree, it was a moral reckoning, reshaping the very power dynamic in the consultation room.
That's a powerful historical thread, demonstrating how profound ethical failures can drive fundamental changes in medical practice. And it leads us neatly into what are now widely accepted as the core ethical pillars in medicine, particularly in orthopedic surgery. We often hear about the 4 principles plus scope approach.
Yes, the Beauchamp and Childress framework, typically.
Could you walk us through those? Perhaps highlighting the inherent tensions or dilemmas they often present in real-world practice.
Certainly, this framework provides a really robust guiding compass for orthopedic surgeons in their decision-making. It comprises 4 primary principles: respect for autonomy, beneficence, non-maleficence, and justice.
The core 4.
Exactly. With confidentiality serving as the crucial plus scope, or sometimes considered part of autonomy and non-maleficence, these aren't just abstract ideas. They directly influence how surgeons interact with patients and the often complex decisions they make.
Right.
And the true insight isn't just that patients have rights, but that a surgeon's most profound ethical challenge often lies in empowering that autonomy, even when the best medical advice might suggest otherwise.
Ah, that's where the tension lies.
Precisely. It leads to nuanced discussions that go far beyond a simple explanation of risks.
Let's dive into respect for autonomy first. It sounds straightforward, the patient's right to choose, but I imagine it involves quite a lot in practice,
It does.
especially when a patient's wishes might diverge from the surgeon's clinical judgment.
It's a cornerstone principle indeed, and often the source of significant ethical tension, as you say. Respect for autonomy means acknowledging the patient's inherent right to make informed decisions about their healthcare.
Their inherent right.
Yes, and this holds true even, and perhaps especially, if those decisions differ from the surgeon's recommendations. The surgeon's obligation here is to provide comprehensive, understandable information.
Understandable being the key word there.
Absolutely. This includes details about their condition, all available treatment options, potential risks, the benefits of each, and also the complications and consequences of choosing no treatment at all.
Right, that's important too.
It's about empowering the patient to genuinely participate in their care, ensuring they understand the why and what if of every path.
That makes perfect sense. But what if a patient isn't in a position to make those decisions themselves? Maybe due to illness or injury? Is autonomy still the guiding star, or does another principle take precedence?
That's an important nuance, and it highlights where principles can intersect or even come into tension. When a patient lacks decision-making capacity, perhaps due to severe cognitive impairment, advanced dementia, or even acute, debilitating pain from a fracture.
Like after a major trauma.
Exactly. In those cases, decisions may need to be made in their best interest. So the orthopedic surgeon collaborates closely with family members or legal guardians.
Okay.
The goal is to ascertain what the patient's likely wishes would have been, or to determine what truly serves their immediate well-being. It becomes a careful balancing act.
Balancing autonomy with...
With the principle of beneficence, ensuring that while the patient's voice is respected as much as possible, they also receive the necessary care to alleviate suffering and promote recovery.
Speaking of beneficence, how does that translate into the orthopedic surgeon's daily duty to do good? It sounds like quite a broad mandate.
It is broad, but very practical. Beneficence is the duty to do good and actively promote the patient's well-being. This isn't just about performing a successful operation. It requires a deep, ongoing commitment.
So beyond the surgery itself.
Oh, yes. It means offering the best possible care, using evidence-based practices, staying rigorously up to date with the latest advancements in the field, whether that's new surgical techniques, implant materials, rehabilitation protocols, you name it.
Keeping current.
Constantly. It also involves carefully weighing the potential benefits of any procedure against its inherent risks. The goal is always to ensure the intervention is truly appropriate and will genuinely improve that individual patient's quality of life or functional outcome.
But not at all costs.
Exactly. It's vital to remember that beneficence should not be pursued at the expense of other ethical principles like autonomy or justice. For instance, a surgeon might believe a certain complex procedure is technically the best, but if the patient declines it, or perhaps can't afford the associated rehabilitation, pursuing it aggressively might violate autonomy or even justice. It's part of a holistic ethical approach where doing good is always contextual.
So do good and then do no harm. It sounds like beneficence and non-maleficence are two sides of the same coin.
They are very closely linked, yes. Often acting as two sides of the same ethical coin, yet each presents its unique challenges.
How do orthopedic surgeons specifically practice non-maleficence, particularly when interventions inherently carry risks? That must be a constant consideration.
It is. Non-maleficence is the fundamental duty to not harm. For an orthopedic surgeon, this translates into taking every adequate precaution to minimize the risks associated with any intervention.
So standard procedures, hygiene.
Well, it goes beyond the obvious. Yes, like employing appropriate surgical techniques, rigorously adhering to sterile procedures, and diligently monitoring patients for complications post-operatively. Those are fundamental, non-negotiable.
Of course.
But non-maleficence truly challenges surgeons when the risks of intervention, however small they might seem, begin to outweigh the potential benefits for that specific patient.
Ah, the risk-benefit calculation.
Precisely. This demands difficult conversations and sometimes the ethical courage to not operate, even when a patient might desire surgery.
That must be tough.
It can be. It means honestly assessing whether the potential for harm, be it infection, nerve damage, prolonged recovery, Even just the burden of rehabilitation justifies the potential for benefit. Always respecting the patient's wishes, of course, and seeking to improve their quality of life and functional outcomes.
That's a critical distinction, the ethical courage to not intervene. And then we have justice. In a world of finite resources, and let's face it, often unequal access, how does the principle of justice play out in orthopedic practice?
Justice delves into fairness and equity in the distribution of healthcare resources. It's a huge area. For orthopedic surgeons, this means ensuring that all patients receive care commensurate with their needs and circumstances,
Regardless of.
regardless of their race, ethnicity, gender, sexual orientation, religion, national origin, socioeconomic status, or insurance coverage.
So it's about more than just individual interactions.
Much more. It includes actively advocating for equitable access to care at a broader societal level and working to address existing disparities in healthcare outcomes across society. To think about waiting lists, access to new technologies.
Right?
It's about ensuring unbiased allocation of resources, whether that's access to new implants, complex surgeries, or even rehabilitation services, and upholding accountability for actions that might inadvertently create or perpetuate inequity. It requires constant vigilance against systemic biases within the healthcare system.
That's a huge societal responsibility beyond the individual patient. And finally, the plus scope of confidentiality. In today's digital age, with electronic records and interconnected systems, how do orthopedic surgeons ensure patient privacy remains paramount? It seems harder than ever.
It presents definite challenges, but confidentiality is paramount, absolutely crucial. It's about maintaining patient privacy and safeguarding their medical information, their history, treatment plans, test results, everything.
So technically, how is that managed?
Well, in the digital age, it means rigorously using protected electronic medical records, EMRs, with robust encryption and access controls, securely storing any paper records in locked facilities, accessible only to authorized personnel,
Yeah.
and employing secure methods for communicating with other healthcare providers, encrypted emails, secure messaging apps, that sort of thing.
But it's more than just the tech, isn't it?
Oh, absolutely. The ethical nuances of confidentiality often arise in unexpected places. Think about the seemingly innocuous corridor conversation or the casual mention of a case in a public area like a canteen. Exactly.
Yeah.
That can inadvertently breach privacy and erode trust, shattering years of effort in an instant. Confidentiality empowers patients by giving them control over their information, aligning deeply with autonomy, and it demands constant vigilance beyond just technological safeguards.
That's a powerful point about the everyday slip-ups. Are there ever situations where confidentiality might ethically be breached? It sounds like such a strict rule, but I imagine there must be limits.
There are indeed, but they are very specific and limited. They represent situations where a greater public or individual safety duty outweighs the duty to maintain privacy.
Such as?
Well, confidentiality might ethically be breached in situations like suspected child abuse, certain infectious disease outbreaks that pose a clear and present risk to public health,
Right.
or when there's a clear and imminent risk of serious harm to the patient themselves or to others.
So very specific, serious circumstances.
Very specific. These are carefully defined exceptions, typically enshrined in law, where the duty to protect the vulnerable or the wider community takes precedence. However, even in these rare cases, the breach should involve the minimum necessary information, disclosed only to the minimum necessary parties.
So these principles form the ethical framework, but they truly come to life within the patient-surgeon relationship itself.
That's right.
How is trust built, and maybe more importantly, maintained in that central dynamic, given its inherent power imbalance?
Well, the orthopedic profession's primary purpose is, unequivocally, patient care, and the physician-patient relationship forms the central focus of all ethical concerns. It's fundamentally based on confidentiality, trust, and honesty.
But it's not automatic.
No, this relationship isn't a given. It's actively built through consistent, transparent communication and demonstrated competence. Both the patient and the orthopedic surgeon are generally free to enter or discontinue a relationship. But this freedom comes with crucial ethical considerations. For instance, a surgeon has an obligation to provide care only for conditions they are truly competent to treat.
Right, staying within their expertise.
Exactly. Accepting a case beyond one's expertise, even with the best intentions, is an ethical breach of beneficence and potentially non-maleficence.
And if a surgeon, for whatever reason, needs to discontinue services with a patient, what's the ethical expectation there to prevent, well, abandonment?
Ah, that's critical. If a surgeon discontinues services, they must give adequate notice, enough time to allow the patient to secure alternative care.
That seems fair.
It's a non-negotiable ethical obligation designed to prevent patient abandonment and ensure continuity of care. This also extends to managed care situations. If a physician or patient's enrollment is discontinued, the surgeon still has an ethical responsibility to assist in obtaining follow-up care.
So they can't just wash their hands of it?
Absolutely not. They need to provide medically necessary care until suitable referrals can be arranged. Furthermore, it's considered unethical for a surgeon to sever a relationship purely because treatment failed or because no further operative treatment is indicated.
Even if there's nothing more they can do surgically.
Even then, the surgeon is ethically obligated to assist in transferring care to an appropriate specialist, perhaps a pain management expert, or a different type of therapist. They need to ensure the patient isn't left without guidance simply because their initial problem couldn't be fully resolved or no more surgery is an option.
That speaks to an ongoing commitment, a partnership that endures beyond the immediate treatment. What about accepting new patients? Are there any ethical boundaries around who an orthopedist can decline?
Absolutely. Orthopedists shall not decline patients solely based on factors unrelated to their medical need or the surgeon's competence. This explicitly includes race, color, gender, sexual orientation, religion, national origin, or any basis that constitutes illegal discrimination. The principle of justice, which we discussed, is very much at play here, ensuring equitable access.
So based on need, not prejudice.
Exactly. The ethical standard is that care should be determined by clinical need and the surgeon's ability to provide it, not by personal prejudice or demographic characteristics.
Moving to a critical foundational aspect of this relationship, informed consent. It's far more than just a signature on a form, isn't it? It feels like the moment autonomy truly comes alive in practice.
Precisely. Informed consent is the critical process where patients are thoroughly informed about the nature of their condition, the risks, benefits, and alternative treatments or procedures.
All the options.
Yes, and then they voluntarily agree to undergo them. Its historical origins go back to 18th and 19th century clinical medicine, but its full ethical weight, well, that's only been properly appreciated more recently.
It's about a partnership, you said.
Yes, it's about a mutual understanding, an alliance forged in knowledge, not merely a legalistic hurdle to jump over.
So what's its dual purpose, and what does a truly comprehensive informed consent discussion involve to achieve that alliance?
It serves two vital purposes. Firstly, and ethically most importantly, it ensures patients fully understand their options. This enables them to make truly informed decisions that align with their own values and goals.
Empowering the patient.
Exactly.
Yeah.
Secondly, it safeguards both patients and surgeons from potential legal liabilities by creating a clear record of the discussion.
Right. And what needs to be covered?
The discussion must cover, in clear, jargon-free language, the nature of the procedure, all associated risks, including rare but severe ones, and the potential benefits.
And the alternative.
Crucially, yes.
Yes.
Any available alternatives, including the option of no treatment at all and its likely consequences. Surgeons must actively encourage patients to ask questions, providing ample opportunity and sufficient time for them to think things over before making a decision.
Not rushing them.
Never rushing them. It's about building an understanding, an active partnership, not just obtaining a signature.
It's fascinating how consent ages and requirements can vary so much across the globe. Could you give us a sense of that variability and the challenges it presents?
It's true. There's a significant lack of uniformity, and this presents a real navigational challenge for orthopedic surgeons, especially in today's globalized medical landscape.
For example?
Well, take India. The age of majority for medical consent is 18. In the USA, it's generally 18, but you have state-specific exceptions, nuances for emancipated minors, specific medical conditions.
Complicated.
Very. The UK allows 16 and 17-year-olds to consent, and even younger individuals can consent if they demonstrate what's called Gillick competence.
Gillick competence.
Meaning they understand the implications and can make a reasoned decision. France generally sets the bar at 18, with specific nuances for emergencies. Germany and Spain might consider 16-year-olds under certain circumstances for minor procedures. Italy generally requires parental agreement for 16-year-olds for most significant procedures.
So it's a real patchwork.
It really is. The key takeaway isn't just the numerical differences. It's the absolute necessity for surgeons to deeply understand and navigate these local regulations. A failure to grasp these nuances can lead to serious ethical and legal repercussions. It highlights how context truly shapes the valid obtainment of consent.
It clearly shows that one size doesn't fit all. And the burden is on the surgeon to know the local context. And I imagine inadequate consent can have serious consequences beyond just legal ones, truly eroding patient trust.
Oh, profoundly.
Can you give us a compelling example of that?
A very compelling and sadly not uncommon example involves a hypothetical Mrs. Patel and Dr. Matthews. Mrs. Patel, say 65 years old with chronic hip pain, sees Dr. Matthews, who recommends a hip replacement.
Okay.
During the pre-surgical consultation, Dr. Matthews is visibly rushed, perhaps preoccupied. He simply hands her a consent form filled with dense medical jargon. He doesn't offer a plain language summary, no real chance for questions.
Just sign here.
Pretty much. He might say it's a standard procedure and urge her to sign so they can book the theater time. Mrs. Patel, trusting him implicitly, feeling perhaps a bit intimidated, signs without truly comprehending the intricacies, the specific risks, or the alternatives.
And what happened after the surgery when her expectations were likely quite different from reality?
Following the surgery, Mrs. Patel faces significant complications she was completely unprepared for. Perhaps a prolonged and painful recovery, maybe a far more limited functional outcome than she had anticipated.
How does she feel?
Utterly betrayed, uninformed, leading to a profound loss of trust, not just in Dr. Matthews, but perhaps in the entire healthcare system.
Oh dear.
This scenario perfectly illustrates the serious ethical and practical failures of insufficient informed consent. It shows how it undermines the very trust relationship that's so crucial. It wasn't just a legal misstep. It was a deep violation of her autonomy and well-being. She felt like an object of a procedure, not an informed partner in her own care.
That's a stark illustration. It really underscores the importance of communication and empathy, which leads me to my next point. Beyond the legalities of consent, how does patient-centered care manifest in day-to-day communication and empathy in orthopedic practice?
Patient-centered care prioritizes the patient's holistic well-being, placing them at the very heart of every decision. This means ensuring transparent and respectful communication. Patients need to feel completely at ease to openly communicate their questions and concerns, no matter how trivial they might seem.
Creating a safe space.
Exactly. Involving patients actively in their treatment plan, decision-making is absolutely crucial for their empowerment and actually for their adherence to the plan later on.
Ah, good point.
Surgeons must also display genuine empathy and offer reassurance throughout the patient's journey. We need to recognize that patients are often experiencing anxiety, fear, or pain, and these emotional states profoundly impact their understanding and decision-making capacity.
So it's about making them feel heard and understood, not just like a collection of symptoms or an X-ray image.
Precisely. Not just a set of symptoms. Does cultural background also play a significant role here, influencing how care is delivered and perceived?
I imagine it must.
Absolutely. Respecting the diverse cultural, religious, and personal values of patients is of utmost importance. It ensures care is not just clinically sound, but also personally resonant and acceptable. It fosters that sense of respect and partnership.
But there are challenges.
However, despite this emphasis on communication, there's a well-documented challenge. Poor communication is a leading cause of medical litigation.
Really? A leading cause?
Yes. It has even been observed, quite shockingly I think, that doctors on average interrupt patients within a mere 23 seconds of them beginning to speak.
23 seconds? That's incredibly short.
It is, and it's a clear barrier to truly understanding their concerns.
It speaks volumes about the pressures on clinicians, perhaps. I've also heard orthopedic surgeons sometimes described, maybe unfairly, as high-tech but low-touch. Is there validity to that perception? And what are the implications for ethical practice?
Unfortunately, that description does exist. And it points to a perceived lack of communication skills and empathy among some orthopedic surgeons. Let me be clear, not all.
Of course.
While they often excel in technical advancements and surgical prowess, mastering complex procedures, using cutting-edge implants, there's sometimes a critical need for improvement in their soft skills.
The human side.
Exactly. This is essential not just for patient satisfaction and positive outcomes, but also for robust ethical practice and preventing misunderstandings that can lead to adverse outcomes, patient dissatisfaction, or even legal issues.
So it's a balance.
It highlights the crucial balance required between supreme surgical skill and compassionate, clear human interaction. A technically perfect surgery can still leave a patient feeling unheard or disrespected if the communication is lacking.
That's a powerful observation that the human element can't be overshadowed by the technical prowess. Beyond the patient relationship, what about the broader professional conduct of orthopedic surgeons? What are the core tenets of personal and professional integrity they're expected to uphold?
Well, the foundation is maintaining an unblemished reputation for truth and honesty in all dealings. In all professional conduct, the orthopedic surgeon is expected to provide competent and compassionate patient care.
Competent and compassionate.
Yes, and exercise appropriate respect for other healthcare professionals, and always keep the patient's best interests paramount. Their conduct must consistently be moral and ethical to merit the confidence patients place in them, a confidence that is fragile and hard-won.
Does it matter how they act outside work?
It does. This also means being mindful of public perception. How a surgeon conducts themselves outside the operating theater can profoundly impact trust within it.
And does that extend to self-discipline and accountability within the profession itself? How do surgeons police their own ranks, ethically speaking?
Yes, absolutely. The orthopedic surgeon should obey all laws, uphold the dignity and honor of the profession, and accept its self-imposed discipline.
Which includes,
This includes an ethical obligation to prevent unethical or illegal activity. This might involve first communicating concerns directly with the individual involved.
a quiet word first.
Ideally, yes. But if that fails, or if the risk is significant, it means reporting them to duly constituted peer review bodies or regulatory agencies and fully cooperating with such authorities. It's a challenging but necessary part of maintaining the integrity of the profession for the benefit of all patients.
Substance abuse and impairment within the profession must be a significant and incredibly sensitive concern. How are those issues addressed ethically, balancing support for colleagues with patient safety?
It's a very difficult balance. Substance abuse is recognized as a special threat that must be avoided, and seeking rehabilitation when necessary is crucial. It is ethical and indeed a moral duty to encourage colleagues who appear chemically dependent to seek rehabilitation, offering support without enabling the problem. Furthermore, surgeons should actively promote their own physical and mental well-being and be attuned to evolving impairment both in themselves and in their colleagues. Burnout is a huge factor here.
Burnout leading to impairment.
It can contribute, yes. They must take or encourage necessary measures to ensure patient safety. This might include medical intervention, professional counseling, or in situations where reasonable offers of assistance are declined and patient safety is compromised. Well, reporting the impairment to appropriate authorities.
That must be very hard to do.
Extremely hard. It's a significant issue, compounded by factors like physician burnout, which affects, estimates suggest between 45% and 55% of all U.S. physicians.
That high.
Yes, impacting enthusiasm, leading to cynicism, diminishing personal accomplishment. Addressing these underlying pressures is also part of the ethical landscape.
That's a sobering statistic about burnout and a complex ethical tightrope to walk. It makes maintaining competence and continuous learning even more challenging, yet ethically vital in a field that's always evolving. How is that commitment expressed?
It's an absolute ethical imperative. Orthopedic surgeons must continuously strive to maintain and improve their medical knowledge and skill, and make their professional attainments available to patients and colleagues.
Why is it so imperative?
This commitment isn't just about personal growth. It's a moral obligation, deeply rooted in the principle of beneficence. It's about ensuring they provide the best possible, most up-to-date care. The ethical burden is to ensure patients benefit from the latest, safest, and most effective treatments available.
So active participation in continuing medical education, or CME, is key, but it goes beyond just ticking a box, doesn't it? It sounds like it needs to be genuine learning.
Precisely. It means actively participating in relevant CME activities, not merely for compliance, but to genuinely stay up to date with the latest treatments, technologies, surgical tools, and techniques.
Like,
Whether it's advanced arthroscopy, new joint replacement materials, bone grafting innovations, fracture fixation methods, the field moves incredibly fast.
right.
Even virtual methods, which were adapted effectively during the COVID-19 pandemic, played a crucial role in maintaining this ethical commitment to learning. The impact is direct and profound.
How so?
Continuously refined surgical skills play a vital role. They directly influence not just surgery duration and efficiency, but crucially, overall patient outcomes and safety.
It truly highlights the dynamic nature of the profession, where stagnation is simply not an option ethically.
Not at all.
And what about professional relationships and collaboration within the broader healthcare team? How do ethics guide these interactions?
Good relationships among physicians, nurses, therapists, all healthcare professionals are absolutely essential for optimal patient care. Surgeons should actively promote the development and utilization of an expert healthcare team that works harmoniously.
Teamwork makes the dream work.
In a way, yes. Recognizing that patient well-being is a shared responsibility. This also extends to collaboration with researchers. That's ethically vital for investigating new implants, new surgical procedures, interventions, identifying areas for quality improvement, and ensuring patient care evolves safely and effectively.
How are orthopedic surgeons held accountable by oversight bodies like hospitals or licensing boards? And what's their ethical role in cooperating with these external reviews?
Professional conduct is scrutinized by a range of important bodies. Local professional associations, hospitals, managed care organizations, peer review committees, state medical and licensing boards. The list goes on.
So, quite a few layers of oversight.
Yes, and it is ethically expected that orthopedic surgeons will not only participate in these groups when called upon, but also cooperate fully with their investigations. This cooperation is fundamental to maintaining public trust and ensuring that the profession can self-regulate effectively, upholding high standards for everyone.
And when it comes to providing expert testimony in legal settings, perhaps in malpractice cases, what are the specific ethical considerations there to ensure impartiality?
Expert testimony. When called upon, surgeons must exercise extreme caution. Their testimony must be scrupulously nonpartisan, scientifically correct, and clinically accurate,
Based only on the facts.
based solely on facts and medical knowledge, not personal bias or any financial incentive. It is unequivocally unethical for a surgeon to testify on matters outside their demonstrated knowledge base.
Sticking to their expertise.
Absolutely. And crucially, it is unethical to accept compensation that is contingent on the litigation outcomes.
Why is that?
Such an arrangement creates an irresolvable conflict of interest. It completely erodes the credibility of the testimony and the integrity of the profession.
What about internal criticism of colleagues or addressing concerns about a colleague's performance? There seems to be a fine line between protecting colleagues and protecting patients.
You've hit on a significant ethical dilemma there. It is considered improper to criticize a colleague in front of other colleagues, trainees, or patients.
Why is that?
Well, it reflects poorly on the critic and can undermine trust in the profession as a whole. Surgeons should also aim to support colleagues who are the subject of unjust claims or unwarranted criticism.
But
However, and this is the critical distinction, if a genuine concern about a colleague's performance arises, maybe inappropriate patient management, inadequate surgical standards, health matters impacting their work, unethical conduct, even financial irregularity.
right.
If that's brought to attention, surgeons are ethically obliged to act. For minor concerns, a private, constructive discussion with the surgeon themselves is often the wise first step.
A direct approach.
Yes, but if patient safety is potentially at direct risk, the concern must be promptly escalated to the medical director, hospital management, bypassing informal channels if necessary. The safety and well-being of the patient must always be the paramount concern.
So clear lines for intervention when patient safety is on the line. Let's move on to another significant area. Navigating financial interests and external influences, specifically conflicts of interest. What's the inherent potential for these in orthopedic practice, and how must they be ethically managed?
Well, the practice of medicine, by its very nature, presents inherent potential for conflicts of interest. It just does.
Because of the commercial aspect.
Yes, because patient care often involves commercial products, services, and sometimes financial relationships with industry. When such conflicts arise, they must always be resolved in the patient's best interest, without exception.
Oh.
Surgeons should explore all reasonable alternatives to ensure appropriate care is provided, always prioritizing clinical need over personal gain. If a conflict cannot be resolved transparently and ethically,
Then what?
then the surgeon should, ideally, notify the patient of their intention to withdraw from the relationship or refer them to someone without that conflict. This avoids even the appearance of impropriety.
What about disclosing financial or ownership interests in other healthcare facilities, say imaging centers or surgery centers, particularly if they're referring patients there?
This is absolutely crucial for transparency and maintaining patient trust. If a surgeon has a financial or ownership interest in, say, a durable medical goods provider, an imaging center, a surgery center, or any other healthcare facility where their financial interest isn't immediately obvious to the patient,
Yes.
they must disclose that financial interest to the patient explicitly. This isn't just a suggestion, it's a fundamental ethical requirement.
And they need to know the rules.
They also have an obligation to know and adhere to the applicable laws regarding physician ownership, compensation, and control. For instance, the Stark II laws in the USA specifically prohibit physician referrals to entities where they have a financial interest, with some exceptions. The spirit of these rules is to prevent situations where financial incentives could potentially influence medical decisions.
And receiving compensation from manufacturers for using specific products, implants, devices, is that ethical? Where's the line drawn there?
It is unequivocally unethical for a surgeon to receive compensation, excluding legitimate royalties from inventions they might hold from a manufacturer, purely for using a particular device or product in their practice,
Why not?
because it would create a direct financial incentive that could bias clinical judgment. Plain and simple. However, fair market reimbursement for reasonable administrative costs incurred in conducting scientifically sound, ethically approved research is acceptable.
Okay, research is different.
Yes. Similarly, when reporting on clinical research or experience with a procedure or product in publications or presentations, surgeons must disclose any financial interest if they or their institution received anything of value from its inventor or manufacturer. Transparency is absolutely key to scientific integrity.
What about surgeons dispensing items like medications, crutches, or orthopedic appliances directly from their offices? Is that an ethical concern?
Generally, surgeons have a right to dispense medication, products, assistive devices, orthopedic appliances, and similar patient care items directly from their practice. They can also provide related facilities or services.
So it's allowed.
It is acceptable, provided it offers genuine convenience or accommodation to the patient, without taking financial advantage of them through, say, inflated prices or restricted choice.
Choice is key then.
Absolutely. The ethical principle here is that the patient must always retain the clear choice to obtain these items elsewhere, and this choice must be communicated effectively. The focus should always be on patient benefit, not profit maximization.
It's clear that the relationship with industry is complex, offering both opportunities and ethical boundaries. How does this relationship typically benefit orthopedic practice and ultimately patients?
Well, the relationship between orthopedic surgeons and industry is, at its best, genuinely symbiotic. It can be very positive.
How so?
Industry provides technologically advanced medical devices, prosthetics, instruments, things that can profoundly enhance patient outcomes and quality of life. They allow for less invasive surgeries, quicker recoveries.
And what does industry get?
In return, industry benefits immensely from surgeons' clinical expertise and input for product development. This ensures products are clinically relevant and effective. Surgeons also participate in rigorous clinical trials to evaluate the safety and effectiveness of new devices, drugs, therapies, providing invaluable real-world data.
Any other benefits?
Furthermore, industry often sponsors high-quality continuing medical education, CME programs. These equip surgeons with the latest knowledge and training on new devices and techniques, which fosters essential communication and skill development across the field.
Yet, you mentioned ethical challenges. How do professional codes of conduct actively address these, ensuring the benefits don't lead to undue influence?
This relationship, while potentially beneficial, does present significant ethical challenges. That necessitates strict adherence to robust ethical codes. In the USA, industry players must follow the advanced U.S. Code of Ethics. This ensures interactions align with values of patient focus and avoid circumvention through disguised payments or incentives. Similarly, the European Federation of National Associations of Orthopedics and Traumatology (EFORT) also sets specific, stringent standards for its members regarding industry interactions.
What's the goal of these codes?
These codes are designed to ensure transparency and prevent undue influence, safeguarding the surgeon's independent clinical judgment. For transparency, for instance, when industry sponsors product promotional meetings or training, it's always preferable for industry to reimburse the orthopedic department or educational institution rather than individual surgeons or trainees directly.
Why is that preferred?
It just looks better. It avoids the perception of direct payment for attendance or participation. Expenses covered should always be reasonable standard travel, modest food accommodation. Fees for orthopedic instructors at such meetings are considered reasonable remuneration for their time and expertise, but these must be declared.
That's a very clear line. Transparency and reasonability.
And what about consultant advice to industry? How should that be structured to maintain independence?
Orthopedic consultant advice to industry can take many forms: research collaboration, participation on advisory boards, giving educational presentations, co-developing products. Lots of ways.
But it needs structure.
All such collaborations must be transparent, with clear written agreements outlining the scope of work and fair compensation based on expertise and time, not product usage. While financial recompense is a legitimate part of this collaboration for intellectual input, a surgeon should under no circumstances be paid simply for using a particular implant or product in their practice.
Right, no kickback.
Exactly. Consultant advisors should always be selected based on their genuine expertise and research capabilities, not on their practice volume or their willingness to adopt specific products. Crucially, surgeons must preserve their clinical independence.
No agreements with industry should include conditions that interfere with their surgical or prescribing practices. No surgeon should ever be persuaded to use an appliance or technique against their better clinical judgment. All agreements and benefits must be fully documented and disclosed to patients if they could in any way influence their management. Complete ethical clarity is essential.
It really sounds like constant vigilance is required. Finally, let's talk about publicity and advertising in orthopedics. It seems like a growing trend, but what are the ethical guidelines that surgeons must adhere to?
Physician advertising is indeed becoming more common, driven by market forces, and professional bodies generally cannot prevent it outright.
But there are rules.
Oh, yes. All advertising and publicity must adhere strictly to regulations and ethical guidelines for medical marketing. It must be factual, verifiable, and above all, not untruthful, misleading, or deceptive. Sanctions exist from bodies like the FTC in the U.S., the AAOS, state medical boards, for false or misleading advertising. It's taken very seriously.
Are there specific phrases or claims that orthopedic surgeons should always avoid because they are inherently misleading?
Yes, absolutely. Surgeons must explicitly avoid terms such as cure if no definitive cure truly exists for a condition. That just sets unrealistic expectations.
Right.
Similarly, describing surgery as painless or bloodless is misleading and potentially dangerous. All surgical interventions carry some degree of discomfort and bleeding.
What else?
Overstating credentials. For example, claiming to be board certified in joint replacement if no such distinct qualification actually exists is unethical. And using hyperbolic terms like world-renowned or claiming unique superiority without objective, verifiable evidence, well, that can be deeply misleading and exploitative of patient vulnerability.
How does this need for ethical truthfulness balance with the public interest in being able to choose a surgeon based on their skills and expertise? People need information.
That's the balancing act. While publicizing one's skills and expertise is generally in the public interest, it allows patients informed choice and access to care. It must be done with utmost responsibility and honesty.
So no boasting.
Surgeons should refrain from claiming precedence over other individuals or organizations, as such claims are often subjective and unsubstantiated. And critically, they must never exploit patients' vulnerability or lack of medical knowledge by making promises that cannot be delivered or by playing on their fears. The core principle guiding all medical advertising must be truth and responsibility, always prioritizing patient well-being over self-promotion.
These principles apply universally, but what about the specific challenges in tailoring orthopedic care for diverse patient populations, like, say, our geriatric patients? They have unique vulnerabilities, don't they?
Geriatric patients indeed present unique vulnerabilities that demand specialized ethical consideration. They often contend with complex physical and psychological impairments, weaker bones, reduced muscle mass, slower healing, all leading to significantly higher risks from surgery and anesthesia.
So what does that mean ethically?
It means obtaining a comprehensive medical history is vital, not just of their orthopedic issue, but identifying underlying systemic conditions, osteoporosis, diabetes, hypertension, cardiovascular disease, all of which profoundly impact treatment strategies and recovery. Ethically, this means actively considering non-surgical options first.
Like physio.
Physical therapy, medications, assistive devices, before resorting to surgery, weighing benefits against potentially much higher risks. Crucially, it involves transparently involving family members or caregivers in care and treatment planning. They often play a pivotal role in support and decision-making.
And after surgery.
We must also anticipate and plan for more intensive post-operative care, robust pain management, tailored physical therapy, vigilant monitoring for complications like delirium or infections, which are more common in older patients.
And their emotional and psychological needs are also critical, I imagine, given the potential for anxiety or isolation that can come with reduced mobility.
Absolutely. It's crucial to address issues like anxiety, depression, or social isolation that older patients may experience. Planning for these emotional needs in advance and proactively involving the patient's family and primary care physician ensures a comprehensive and holistic approach. It extends beyond just the orthopedic repair to their overall well-being and dignity.
What about pediatric patients? The dynamics there are quite different, particularly concerning informed consent. You can't just ask a 5-year-old.
Indeed. Dealing with pediatric patients demands highly specialized skills, knowledge, and a profoundly patient-centered ethical approach.
Yeah.
Since many children, especially younger ones, lack the cognitive capacity for direct informed consent.
Right.
True informed consent must be meticulously obtained through third parties, typically parents or legal guardians. Communication here is absolutely key.
Yeah.
It must be age-appropriate and understandable for both the child, to the extent possible, and their parents. Gently explaining diagnoses, treatment options, risks, in a way that neither frightens nor condescends. Building rapport and demonstrating patience are essential to ease their nervousness and gain their cooperation.
Is teamwork important?
Very often, a multidisciplinary approach is frequently necessary for certain pediatric conditions, involving pediatricians, physical therapists, occupational therapists, other specialists to ensure comprehensive care. And discussing preventative measures, nutrition, exercise, safety precautions like helmet use is also crucial in managing long-term orthopedic health in children.
And for patients facing significant financial hardship, how do orthopedic surgeons uphold ethical care when resource constraints are so stark? It must be incredibly difficult.
Providing quality care irrespective of financial status is paramount. It's a direct application of the justice principle we discussed earlier. Surgeons must empathize deeply with patients experiencing stress or anxiety due to financial struggles and actively listen to their concerns without judgment.
What practical steps can they take?
Transparency about treatment costs and potential out-of-pocket expenses is vital. It enables truly informed decisions, allowing patients to weigh options based on their real-world circumstances. It's also important to explore referring patients to community resources, local charities, government programs, patient assistance funds for help.
Anything else?
Prioritizing preventive care can help avoid more serious, costly issues down the line. And compassionately, for those truly in desperate need, surgeons may ethically consider providing certain services free or at a reduced cost, or at least advocating strongly for their access within the system. It's about ensuring basic human dignity and care, regardless of their wallet.
Moving on to navigating difficult patient interactions. How should an orthopedic surgeon ethically manage a patient who isn't adhering to their treatment plan, perhaps out of fear or misunderstanding, or just finding it too hard?
Patient non-adherence is a really complex issue. There are diverse underlying reasons, misunderstandings about the treatment, fear of surgery or pain, financial limitations, sometimes deeply held personal beliefs that conflict with medical advice.
So what's the first step?
The crucial first step is establishing open and honest communication channels, encouraging patients to voice their concerns, and actively listening to identify the root causes of their non-compliance.
Trying to understand why.
Exactly. It's about collaboratively developing solutions tailored to their specific needs and circumstances, rather than simply dictating terms or getting frustrated. If a patient genuinely cannot or will not adhere to a recommended plan, then exploring alternative, perhaps less ideal but more acceptable, approaches better suited to their situation is warranted.
So it's not about blame.
Not at all. Recognizing non-compliance is a multifaceted issue, requiring a personalized differential diagnosis approach rather than a judgment, leads to far more effective and ethical intervention.
And when faced with an angry patient, how does a surgeon handle that ethically and effectively, especially when emotions are running high? That must take skill.
Handling angry patients can be profoundly challenging, yes. It really tests a surgeon's composure. But staying composed and calm is crucial. It's vital to avoid defensiveness or emotional reactivity, which only ever escalates the situation.
So, stay calm and
Actively listen.
Uh.
Listen to their concerns, allow patients to fully express their feelings, and try to identify the underlying cause of the anger. Employ de-escalation techniques, acknowledging their feelings, validating their distress is essential.
apologize.
If appropriate and genuinely warranted, yes. Apologizing for errors or misunderstandings can help diffuse the situation and rebuild rapport. Providing clear, concise, and empathetic explanations about their condition and treatment options can also help to reestablish a sense of control and understanding for the patient.
Can you provide a vivid example of how an orthopedic surgeon successfully navigates such a charged situation, turning anger into renewed trust?
Certainly. Let's consider a hypothetical Mr. Sahu, perhaps a construction worker. 3 months after complex wrist surgery, he's still experiencing significant discomfort and limited mobility, severely affecting his livelihood. He approaches his surgeon, let's call her Dr. Patro, visibly upset.
Okay.
He exclaims, "You said I'd be back to work by now. My family is suffering because of this." Dr. Patro, rather than becoming defensive, calmly invites Mr. Sahu to sit. She might say something like, "Mr. Sahu, I'm genuinely sorry for the distress you're feeling and the impact this is having on your life. Let's go over your concerns thoroughly."
So empathy first.
Exactly. She listens intently, allows Mr. Sahu to vent without interruption. Then she performs a thorough examination of the wrist, reviews the latest x-rays, and explains gently but clearly that while the surgery itself was successful, healing from such a complex injury can sometimes take longer due to individual physiological factors. She acknowledges his legitimate concerns about his livelihood.
So validating his concern.
Yes. Then Dr. Patro proposes a revised, more intensive rehabilitation plan, perhaps including a referral to a specialist physiotherapist renowned for complex hand injuries. She might offer to provide a detailed letter for his employer.
Taking concrete action.
Right. Dr. Patro assures Mr. Sahu they'll work closely, monitoring every step to optimize his recovery. Mr. Sahu likely leaves with renewed hope and a sense of trust, having felt heard and understood.
That's a great example.
It exemplifies patient-centered communication, deep empathy, and proactive problem-solving, turning a potential confrontation into a collaborative path forward.
That's a masterclass in de-escalation and rebuilding trust. Now let's talk about medico-legal risks. What are the common issues orthopedic surgeons face, and more importantly, how can they ethically and practically mitigate them?
Orthopedic surgeons, like other specialists, do frequently encounter medical legal issues, particularly medical malpractice lawsuits. These typically arise from a perceived breach of the duty of care, such as misdiagnosis, surgical errors, inadequate follow-up care, or, as we've discussed, insufficient informed consent.
How can they mitigate these risks?
Ethically and practically, maintaining accurate and comprehensive medical records is absolutely essential. Every detailed history, examination findings, test results, treatment plans, progress notes must be meticulously documented. This documentation serves as the complete and accurate narrative of the patient's care.
What else?
Stressing adherence to all relevant regulations and laws, safety protocols, proper certifications, ethical standards within the profession. The axiom "you learn from your mistakes" is unfortunately often undervalued in healthcare. Instead, the critical significance of prevention and proactive risk management in handling medical legal issues cannot be overstated. It's about building a culture of safety and accountability from the outset.
You've provided some hypothetical cases illustrating ethical breaches leading to legal consequences. Could you walk us through a few, really driving home the why behind the legal finding in each case?
Certainly. These illustrate the real-world impact. Take improper consent. Imagine Dr. Manhanti performs a spinal fusion on Mrs. Mahapatra, but the consent form only listed a discectomy, a different, less invasive procedure.
Oh dear.
Post-surgery, Mrs. Mahapatra suffers severe complications unrelated to a discectomy. The court rules emphatically in her favor due to a clear lack of proper informed consent and a profound breach of her autonomy. She simply hadn't agreed to the procedure performed.
Clear cut.
Another failure to diagnose. Mr. Agarwal presents with persistent hip pain. Dr. Jain dismisses it as a minor strain, advises rest. It's later discovered, after significant delay, to be a hip fracture.
Leading to worse outcomes.
Exactly. The court deems Dr. Jain negligent for failing to properly diagnose and treat it, leading to a much more complex and painful recovery for Mr. Agarwal than if it had been caught early. The ethical lapse was the failure to adequately investigate and provide a reasonable standard of care.
And what about issues related to the procedure itself, or even performing unnecessary interventions?
Okay, improper technique or equipment. Consider Mr. Murmu's knee replacement. Dr. Nerati uses an outdated surgical technique and, critically, a recalled implant. This results in chronic pain and further complications for Mr. Murmu.
Recalled. That's bad.
Very bad. The court finds Dr. Nerati liable for professional negligence, not only for failing to keep abreast of modern, safer techniques, but also for the egregious error of using recalled equipment, a profound lapse in patient safety.
And post-op issues.
Failure to address post-operative complications. Mrs. Kaur develops clear signs of deep vein thrombosis, DVT, after ankle surgery. Dr. Da fails to address these promptly despite the warning signs. Due to the severe potential consequences of untreated DVT, including a life-threatening pulmonary embolism, the court finds Dr. Das negligent in post-operative care. Lastly, unnecessary surgery. Dr. Tripathi suggests and performs an invasive shoulder surgery on Mrs. Panda, when ethically and clinically, physical therapy was clearly a more appropriate, first-line, and less risky treatment. The court finds the surgery unnecessary and Dr. Tripathi liable for not considering non-surgical alternatives and, critically, for not acting in the patient's best interest by recommending the least invasive effective option first.
These hypotheticals vividly illustrate the grave repercussions of ethical and clinical lapses. Beyond individual patient care, orthopedic surgeons have a broader social responsibility, don't they? How does the profession contribute to society as a whole?
Absolutely. The honored ideals of the medical profession imply that the orthopedic surgeon's responsibility extends beyond the individual patient to society as a whole.
How does that manifest?
This includes active participation in activities aimed at improving community health and well-being in a cost-effective way. Think about public health campaigns, injury prevention programs, maybe advocating for better public infrastructure that supports mobility and reduces falls.
And patient rights?
It also means actively advocating for patients' rights at a systemic level, including equitable access to quality care for all and respect for diverse cultural and personal beliefs within the healthcare system. This aligns with the spirit of ethical codes, like the AMA's Code of Medical Ethics, which supports access for all individuals, regardless of their background or means.
How do ethical considerations shift or become particularly acute when orthopedic surgeons work in resource-limited settings where choices are often stark and difficult?
In resource-limited settings, the ethical landscape becomes incredibly challenging. Surgeons require specific, in-depth knowledge of various injuries and conditions, along with suitable treatment options that can realistically be provided with limited means, often without the advanced diagnostics, implants, or rehabilitation facilities common in wealthier nations.
So they have to adapt.
Massively. Expertise is critically needed to prioritize treatments based on severity and available resources, sometimes making agonizing decisions about who receives what level of care. Collaboration with other healthcare professionals, physios, occupational therapists, primary care physicians is vital for comprehensive care, as is sharing limited resources with local facilities to optimize what little is available.
Cost becomes a huge factor.
Immense. For example, a survey revealed that over 80% of surgeons using certain orthobiologic products lacked accurate cost perception in such settings. This highlights the critical need for informed and ethical decisions regarding resource allocation, where every penny, every resource really counts.
And how do these broader global health disparities, influenced by cultural, economic, and societal factors, influence ethical practice in orthopedics worldwide? It sounds incredibly complex.
Cultural, economic, and societal factors profoundly influence ethics globally, creating a complex tapestry of challenges. It's not uniform at all. Developed nations, paradoxically, often face challenges like overtreatment driven by financial incentives and persistent healthcare disparities within their own affluent systems. Meanwhile, developing nations often grapple with fundamental issues like severely limited resources, pervasive issues of bribery or corruption affecting care delivery, and a dire lack of trained medical professionals.
And emerging economies.
They often face a delicate balancing act between traditional and modern medicine, the rise of medical tourism, which can create a two-tiered system, and the increasing commercialization of healthcare.
So what's the constant?
Through all these starkly different challenges, the importance of empathy and compassion remains paramount, a universal constant. As Mahatma Gandhi famously said, "You must not lose faith in humanity. Humanity is like an ocean. If a few drops of the ocean are dirty, the ocean does not become dirty."
That's a good quote for this context.
It's about focusing on the vast good that can still be done, even in the face of daunting challenges.
That's a powerful sentiment to carry into such a complex global field. And what about the ethical considerations in research? It's so crucial for progress in orthopedics, but also carries its own unique risks and responsibilities.
Research is indeed essential for progress. It aims to increase our understanding of disease and improve patient outcomes. However, it absolutely operates within strict ethical boundaries.
Such as?
All research must be carefully considered and approved by an institution's ethical committee or institutional review board, an IRB. They act as critical guardians of patient safety and rights. Researchers should always strive to reduce risks to participants while maximizing potential benefits. And where possible, laboratory experiments or in vitro studies should be preferred over animal or human ones to minimize harm.
And informed consent in research must be especially rigorous, I'd imagine, given that participants are often vulnerable or hoping for a breakthrough.
Absolutely. Patients participating in research must give full, truly informed consent. This means they must clearly understand the objectives of the research, all potential risks and discomforts, any potential benefits, and importantly, the alternative treatments available outside the study.
Can they change their mind?
They must retain the unequivocal right to withdraw from the study at any time without penalty or any impact on their ongoing care. While junior team members might provide detailed information, a senior investigator ultimately holds the responsibility to ensure proper understanding and address any concerns.
Should they be told the results?
Furthermore, ethically, volunteers should be informed of the research outcomes, fostering transparency and trust, even if the results are not what they or the researchers hoped for.
What about integrity and avoiding misconduct in research? It sounds like there could be many pitfalls or temptations for researchers under pressure to publish or find funding.
Honesty and integrity are paramount in research. They are the bedrock of scientific validity. Societal misconduct in research, including fabrication of data, falsification of results, plagiarism, these are direct and egregious breaches of fundamental ethical principles.
What else constitutes misconduct?
Proper acknowledgement of all sources and intellectual contributions is crucial. Only significant contributors who have genuinely contributed to the work should be named as authors, no gift authorship. Complete records of all scientific research, raw data, protocols, analysis should be meticulously retained for at least 5 years after publication. This ensures critical review or reanalysis if needed.
And financial interests.
Any financial interest or anything of value received by investigators, their team, or institution from sponsors, whether industry, charities, or governments, must be fully disclosed to patients participating in the research. Transparency here is not optional. It's essential to prevent bias and maintain public trust.
And reporting results, especially poor ones, must be a particular ethical challenge, as you mentioned. People might be tempted to bury bad news.
It absolutely is. But poor results must never be excluded or suppressed. Outcomes must be presented in a timely, objective, accurate, and complete way. This means reporting both positive and negative findings honestly.
What if early results looked good, but later ones didn't?
If initial excellent results for a new technique or product cannot be reproduced in later, larger studies, those later, less favorable results must be reported promptly. This prevents widespread damaging or ineffective usage based on premature, overly optimistic data. Editors and peer reviewers in scientific journals must be vigilant for fraud, as there's always a temptation to present results favorably for publication or career advancement. The ethical imperative is to contribute to genuine knowledge, not just positive findings.
I've heard concerns about how new surgical techniques are sometimes introduced. Is there an ethical issue there compared to, say, the more rigorous controls in pharmaceutical development? It seems less regulated sometimes.
There can be, yes, and it's a significant ethical concern. There's sometimes what might be described as a haphazard way in which new surgical techniques and products are introduced into widespread clinical practice.
How so?
Patients can be drawn to the latest trends or promising early results before robust, long-term comparative evaluations are complete. This contrasts sharply with the more rigorous, multi-phase clinical trial controls often seen in the pharmaceutical industry, where a new drug must pass through extensive testing before widespread adoption.
Raising ethical questions.
It raises ethical questions about patient safety and that crucial balance between innovation and proven efficacy. Another complex ethical issue in research is the disparity between developed and developing nations. Better facilities and finances in developed countries can lead to an inequitable distribution of research opportunities and benefits. Solutions should aim to ensure equity, allowing global populations to benefit from research advances rather than just being subjects for studies conducted elsewhere.
That's a lot to consider as technology rapidly advances. How do orthopedic surgeons ethically balance the push for innovation with the fundamental principles of safety and efficacy, and also managing patient expectations?
Orthopedics stands at a fascinating yet ethically challenging juncture. Rapid technological advancement, advanced robotic techniques, new biomaterials, personalized prosthetics allows for unprecedented care. But surgeons must vigilantly weigh the potential benefits against the associated risks of these novel interventions and fully explain them for truly informed consent. The affordability and accessibility of advanced treatments, like expensive prosthetics and implants, raise significant concerns about justice and equity.
The fairness issue again?
Yes. Surgeons have an ethical duty to advocate for their patients to ensure innovative treatments are accessible to a broader population, not just the privileged few. Also, the excitement around advanced surgical options can unfortunately lead to unrealistic patient expectations.
How should surgeons handle that?
They must proactively manage these expectations by providing a clear, honest, and realistic understanding of what can actually be achieved, including potential complications, the realities of post-operative recovery, and the long-term prognosis. managing hope without overpromising.
And the emergence of truly novel technologies like artificial intelligence, AI, and machine
Yeah.
learning, ML. What new ethical questions do they bring to orthopedic practice? This feels like a whole new frontier.
AI and ML certainly present new ethical frontiers. While they hold immense promise, they can undoubtedly improve diagnostic accuracy, personalized treatment plans based on vast data sets, even assist during surgery.
There are concerns.
They also raise significant ethical concerns,
Mm,
issues of data privacy and security, algorithmic bias that could lead to disparities in care if the training data isn't representative.
right.
The transparency of AI decision-making, the black box problem where we don't always know why the AI recommended something, and crucially, the potential impact on the surgeon's clinical intuition and the irreplaceable human element in patient care.
So we need caution.
Careful, deliberate, and ethically guided integration of these technologies is required. We need to ensure they truly serve patient well-being without compromising core ethical principles or diminishing the human connection that defines good medicine.
Given all these evolving complexities, what is the vital role of professional organizations in shaping and upholding orthopedic ethics in this dynamic landscape? Bodies like the AAOS or EFORT.
Professional organizations like the American Academy of Orthopedic Surgeons,
Hmm.
AAOS, and the European Federation of National Associations of Orthopedics and Traumatology, EFORT, play an absolutely crucial role. They are not merely administrative bodies.
What do they do?
They actively support surgeons, advance the entire orthopedic field, and work tirelessly to improve patient care quality across the board. They offer vital continuing education opportunities through conferences, webinars, online modules, ensuring surgeons stay current.
Setting standards.
Yes, they develop and promote clinical practice standards and ethical guidelines to ensure evidence-based and high-quality care. And they actively support research and innovation through funding and collaboration, steering it towards ethical and patient-centered outcomes.
So they're not just setting standards, but actively enabling progress and professional growth, too.
Precisely. Beyond their internal functions, they also advocate strongly for surgeons and patients at various governmental and policy levels, striving for improved access to care, robust research funding, fair reimbursement models that support ethical practice.
And connecting people.
They provide invaluable networking opportunities, fostering knowledge sharing and research collaboration among their members. Leaders like former EFORT President Rolf Soren have suggested that such societies should go beyond traditional clinical exchange. They should routinely assess hot topics in the evolving healthcare environment, like AI, health tourism, resource scarcity, and explore their impact on the profession and how doctors' roles must adapt in changing societies. They are truly dynamic forces in upholding and evolving ethical practice for the benefit of all.
What a comprehensive deep dive this has been into the intricate world of ethics in orthopedic practice. It's clear it's so much more than just a rule book, isn't it?
It truly highlights that ethical considerations are not just an add-on or some separate module you do in training. They are absolutely fundamental to every single aspect of orthopedic practice.
From start to finish.
From the moment a patient walks in, through surgery, and deep into rehabilitation and follow-up. Strict adherence to these principles ensures patient trust and safety and genuinely elevates the standing of the entire orthopedic community. It's about maintaining honesty, compassion, and skill in every interaction.
And it's a constant balancing act, isn't it, between rapidly evolving technology, those timeless ethical principles we talked about, and above all, deeply patient-centric care.
Yes.
It demands continuous learning, vigilance, and profound empathy.
Indeed. The therapeutic alliance between doctor and patient should always be based on understanding, confidence, and cooperation. That forms the unwavering platform for successful treatment. If we rely solely on technique and neglect our ethics of service, we risk becoming merely a trade, not a true profession. We must continue to earn and deserve the profound trust patients place in us every single day.
So what does this all mean for you, our listener? We've explored how vital ethics are in orthopedic practice, but what ethical dilemmas, perhaps in your own professional sphere, whatever that may be, might benefit from applying that four principles plus confidentiality approach we've discussed today.
That's a good question to reflect on.
If you found this deep dive insightful, please do consider leaving us a rating or sharing it with others who might benefit from this detailed exploration of crucial professional responsibilities. It truly helps us reach more curious minds like yours.